Hello everyone. I am Abubakar Forna. Today, I will be discussing fainting as a topic. But before we start, someone may want to ask, what is fainting by the way? Fainting is a temporary loss of consciousness from a sudden decrease of blood flow to your brain. An episode usually lasts a few seconds or minutes. Most are harmless, but if you faint often or have other symptoms, you should seek medical attention. In other words, fainting is a short-term loss of consciousness. It happens because of a sudden drop in blood flow to your brain. Other names for fainting are 1. Decreased consciousness. 2. Loss of consciousness. 3. Passing out. And 4. Syncope. Are there stages or different severity levels of fainting? Signs you're about to faint may include feeling 1. Cold and clammy. 2. Dizzy. 3. Lightheaded. 4. Hot and suddenly sweaty. 5. Sick to your stomach. 6. Stressed out or anxious. 7. Weak. In addition, you may 8. Fall down. 9. Get a headache. 10. Have vision changes, whiteout, blackout, or see stars after having blurry or tunnel vision. 11. Hear ringing in your ears. 12. Lose control of your muscles. What are the most common causes of fainting? The most common reason for fainting is a sudden drop in blood pressure, which reduces blood flow and oxygen to your brain. There are many reasons why a drop in blood pressure could lead to a temporary loss of consciousness. 1. Cardiac syncope. This type of syncope involves fainting because of a heart problem. Many heart conditions can affect how much oxygenated blood your heart can pump to your brain. This type makes up 15% of fainting incidents. 2. Carotid sinus syncope. This type of syncope can happen when something pinches or constricts the carotid artery in your neck. The carotid artery is a blood vessel that supplies your brain. This type of fainting can occur when someone wears a very tight collar, stretches or turns their neck too much, or has a bone in their neck that's pinching their artery. 3. Vasovagal syncope. This can occur when a person experiences a stressful event. Examples include the sight of blood, emotional stress, physical trauma, emotional trauma or pain. The stressful event stimulates a bodily reflex called the vasovagal reaction. Your heart slows down and pumps less blood, so your blood pressure drops. Then, your brain doesn't get enough oxygenated blood, and you faint. Certain bodily movements or functions also can naturally cause a drop in blood pressure that may lead to fainting spells. Examples include when a person pees, poops, coughs or stretches. Other possible causes of fainting you may faint because of 4. Certain medications that treat high blood pressure, such as diuretics, water pills, calcium channel blockers and angiotensin-converting enzyme ACE inhibitors. Other examples include nitrates for heart disease, antipsychotics for mental health disorders, antihistamines for allergies and opioids for pain. 5. Dehydration or overheating. 6. A neurologic condition, such as a seizure disorder or stroke. 7. A sudden drop in blood sugar, as may happen in a person who has diabetes. 8. An unknown reason, which happens in up to 50% of fainting cases. Activities that may cause you to faint. Things you do with your body that can make you faint include 1. Skipping too many meals. 2. Hyperventilating, breathing too fast. 3. Working, playing or exercising too hard, especially in the heat. 4. Standing up too quickly. 5. Using alcohol, marijuana or illegal drugs. First aid for fainting if someone loses consciousness. 1. Make sure the person's airway is clear. 2. Check that the person is breathing. 3. Check that their heart is beating. 4. Call 911 or call 117 for Sierra Leone, or seek immediate medical attention if they're hurt. 5. Start CPR if the person isn't breathing or if you don't feel a pulse. 6. Ask someone to look for an automated external defibrillator (ED) if needed. When someone faints and then wakes up, 1. Encourage them to sit down or lie down for 10 to 15 minutes, sometimes longer, until symptoms pass. 2. Check for any injuries that might need medical attention, such as a head injury or a cut. 3. Suggest that they sit forward and lower their head below their shoulders and knees. 4. Offer ice or cold water. Can fainting be prevented? Yes, you can prevent fainting when you know what causes you to faint. Pay attention to specific activities or situations that make you faint. For example, if getting up too quickly sometimes makes you faint, learn to take your time standing up. You can also move your legs to help your blood move before you stand up. If you notice how you feel just before you faint, you can try certain strategies to prevent it. 1. Make a fist with your hand. 2. Tense your arms. 3. Cross your legs. 4. Squeeze your thighs together. 5. Lie down. 6. Sit, lean forward and put your head between your knees. Thanks for watching. Once again, I am Abubakar Forna. If you find this video helpful, please don't forget to like, comment, and subscribe to my YouTube channel. Click on the bell and click all for more videos. You can also follow me on my Facebook page, at Forna Graphic Design, and TikTok, at Busca32. See you in my next videos.